In this lecture, we're going to be discussing the basic theory and development of CBT, cognitive behavioral therapy. The outcomes are going to be an introduction to the 3 waves of therapy, perspectives of behavioral therapy, origins of cognitive behavioral therapy, concepts and theory of CBT, and application and efficacy of CBT. Introduction, 3 waves of therapy. Cognitive behavioral therapy, or CBT, is a relatively modern approach to psychotherapy that was developed from the 1960s. In general, psychotherapy is the treatment of a client's mental health problems by talking with a psychiatrist, psychologist, licensed clinical mental health provider. It can also involve expression through music, art, play, meditation, amongst others. CBT was preceded by 2 other main perspectives, namely psychoanalytic therapy and behavioral therapy, where psychoanalytic approaches focused on the conscious and unconscious mental functioning of a person through the lens of childhood events. Behavioral therapies were only concerned with changing the person's behavior without considering its roots or cognitive content. With the advent of cognitive therapy, the importance of automatic negative thinking on the expression of problematic behavior was recognized. Gradually, more focus was placed on the elimination of dysfunctional force with the ultimate objective to change behavior, and cognitive behavioral therapy introduced the 3rd generation of therapies. Now we're going to discuss behavioral therapy. Behavioral therapy is already more than a century since Freud proposed the three-layered model of human mind and science has not yet provided any evidence to support it. With the progress in neuroscience and the advent of cognitive psychology, however, a more complex view of non-conscious processes are possible. But first, behavior therapies were developed based on the need for an effective short-term therapy for anxiety, depression, and other emotional adjustments that veterans of the Second World War faced on their return home. Behavioral learning theory was the initial basis of the wave of behavior therapy, which was considered a revolutionary challenge to psychoanalytic therapy. Behavior therapy is narrowly focused on changing a client's behavior by engaging in positive or socially reinforcing behavior. It is a structured approach that carefully monitors what a person is doing in order to identify opportunities for positive experiences. The focus is present-orientated and on current causes of distress or maintenance of improvements. As such, it is problem-orientated and goal-directed, with the only objective to change behavior. Theory-based rather than individualized. And the therapist-client relationship follows a top-down strategy of information processing and knowledge sharing. Classical behavior therapy is a set of clinical procedures that are based on principles of learning that are systematically applied to achieve specific treatment goals that are measured by focusing on the client's current behavior problems. The 4 main aspects of classical behavior therapy are: 1, exposure and desensitization. In vivo desensitization involves brief and graduated exposure of an accrual fear situation or event, or prolonged and intensive in vivo or imaginal exposure anxiety, evoking stimuli without the opportunity to avoid it. It's known as flooding. In addition, eye movement, desensitization and reprocessing. MDR applies rhythmic eye movements and other bilateral stimulation to manage fearful memories. 2, classical conditioning is a type of learning that originally described by Ivan Pavlov that occurs through interactions with the environment in an instinctive reflex instead of being mediated by controlled thoughts, feelings, and emotions. By producing conditioned response, fears and phobias can be managed and aversion stimulated by manipulating the environment. Operant conditioning, it is also a learning process, but occurs through awards and punishment from behavior by a association between the behavior and consequence. Its first proponent, behaviorist B.F. Skinner, believed that external observable causes of human behavior and the consequences directly associated with it explain behavior instead of force and feelings and emotions. Operant conditioning is commonly used in everyday life, the promise of possibility of rewards and punishment, and is effectively a reaction to past consequences. Social learning, it is a process of learning whereby others' behavior, attitudes, and outcomes of behaviors observed and imitated or used as a model for appropriate or desired behavior. In this sense, this is where continuous reciprocal interaction between cognitive, behavioral, environmental influences. It's important to realize that behavior therapy is only designed to change behavior and not an underlying personal characteristic trait, according to Milton Berger 212. As such, it is not concerned with associated clinical condition, but only desirable and observable behavioral excesses or deficits. There's a strong emphasis on current environmental events that are associated with the problematic behavior, and once these control events are identified, they are altered to achieve a behavioral goal. Essentially, it is a self-regulating process with the therapist acting as facilitator. But even more importantly, there is a de-emphasis on the relevance of past events on current social behavior, and therefore underlying causes are rejected. It is outside the scope of this lecture to engage with more details of classic behavioral therapies, but for now, it suffices to note that the main limitations and criticisms of behavioral therapy are the cognitive processes and experiences and their correlation with behavior. Are de-emphasized, relational factors are largely ignored. Symptoms are treated rather than causes, and it does not provide a deeper insight into the factors that may be contributing to internal distress and problematic behavior. It is considered by many scholars and practitioners to be standardized and mechanistic, with the therapist applying control and manipulation to affect behavior change. As such, it lacks promotion of internal growth and meaningful impact, and an identification and understanding of the real problem that is required to achieve and maintain positive change and prevent relapse. Now we'll discuss cognitive behavioral therapy in the third wave. In the third generation or third wave therapies developed by cognitive therapy in the 1960s, Beck recognized the importance of thinking patterns and unconscious mental processes in shaping and motivating behavior. Up to that time, cognitive process was not afforded much prominence in psychotherapy. The limitations of not considering thoughts, feelings, beliefs, and interpretations were obviously played an important role to motivate behavior, cause dissatisfaction with purely behavioral approaches, according to Westbrook, Kennelly, and Kirk 211. In the 1970s, the recognition of shortcomings of behavioral approaches led to what has been known as a cognitive revolution, whereas cognitive phenomena were brought into the theoretical and practical framework of modern psychotherapy methods. Beyond classical CBT, there are many similarities. Third wave CBT therapists base themselves on empirical research. They acknowledge the important role of behavior just as much, if not more, than traditional CBT. Most also continue to acknowledge the important role of cognition's thinking. So what is different? Some of the main theoretical differences seem to be about control and emotional avoidance. The question became whether trying to control our thoughts and emotions is part of the solution or the problem. Up to recently, the focus was only on contents of thoughts rather than their context or the thinking process itself. The third generation or third wave of therapies is a loose affiliation to cognitive behavioral based approaches and are not defined by any specific criteria and the inclusion sometimes disputed by developers. Well-known examples that are increasingly attracting empirical research and new applications: acceptance and commitment therapy, dialectic behavioral therapy, schema therapy, mindful-based cognitive therapy, and mode deactivation therapy. As psychoanalytic perspectives gave way to behavior therapies in an attempt to deal with psychological problems more quickly and directly, cognitive behavioral therapies approaches again recognized a significant piece of behavioral puzzle would remain unaddressed if thinking patterns were ignored. In an important sense, behavior follows cognition. Cognitive behavioral therapy, CBT, is goal-orientated, is goal-directed. Short-term treatment is based on Dr. Aaron Beck's observations in the 60s, in which the therapist and client work collaboratively to resolve the client problematic behaviors and emotions by solving problematic thinking. Its goal is to change thinking patterns for the clients, thinking and behavior that are the source of difficulties. Beck recognizes the significance of the link between thoughts and feelings and the fact that people are often not fully aware of these thoughts. Thus, he invented the term automatic thoughts, but theorized that people can be guided to become aware and identify such thoughts. As behavioral techniques were employed as well, the approach became known as cognitive behavioral therapy, or CBT. Since then, CBT has been applied to a growing variety of problems and has spawned many derivative approaches, which are often referred to as third generation or third wave therapies. CBT was originally conceptualized by exploring psychoanalytic concepts of depression, when Dr. Beck found that depressed patients experienced streams of negative thoughts that seemed to arise spontaneously. These negative thoughts were often unrealistic views of themselves, others, the world. By providing assistance to clients to become aware of and evaluate these thoughts, clients were able to think more realistically and as a result felt better emotionally and behaved more functionally. In 1964, Beck wrote 2 important papers in which he explained the link between thinking and depression in terms of idiosyncratic content and cognitive distortions of thoughts, and how he related these concepts to theory and practice by the way of schema concepts. Beck found that deviation from logical and realistic thinking forms a thematic content that can distinguish clinical groups, and that a thought disorder may be common to types of psychopathology. In particular, arbitrary inference, selective abstraction, overgeneralization, magnification, and minimizations were identified as dysfunctional thinking processes by Beck in 1964. He also argued that disturbance seemed to be secondary to thinking disorder, as the distorted ideas appeared immediately before arousal of the problem effect. Although there may also be a reciprocal interaction between dysfunctional cognition and effect, furthermore, it's concluded idiosyncratic schemas underlie these irrational thought processes, whereby flexibility and appropriate response to environmental stimuli was ultimately sacrificed. Beck defined schemas as stereotyped or repetitive patterns of conceptualization that are regarded as manifestations of cognitive organizations or structures that are relatively enduring components of cognition in 64. In other words, a schema is a structure that is involved in the screening, coding, and evaluating of incoming stimuli. In essence, it presents the way that an individual interprets experiences meaningfully, adapts to external reality, and responds accordingly. Raw input data is molded into thoughts, and feelings act as motivators for behavior, but may not necessarily be effective or appropriate in new circumstances. Schemas are not directly observable, but can be inferred by observing behavior and exploring thoughts and feelings, according to Beck, 1964. The most striking characteristics of the schemas is their content. The content is generally in the form of a generalization and corresponds to individuals' attitudes, goals, values, and conceptions. The conceptions of idiosyncratic schemas found in psychopathology is reflected in the typical chronic misconceptions, distorted attitudes, invalid premises, and unrealistic goals or expectations. That can be found in page 563, 1964 publication by Beck. As such, the main objective of CBT is to identify the content of the client's schemas by analysis of their ways of structuring and expressing experiences from recurring themes in thoughts, free associations, and ruminations, from thematic dream content, from direct questioning about attitudes, beliefs, values, and expectations, and lastly by psychological testing instruments designed to measure fears and beliefs about themselves and the world, others in the world. As distortions in the person's thinking and judgment lead to psychological distress and dysfunctional behavior, those false assumptions and beliefs underlie problematic feelings and responses to events that are identified in modified in CBT with objectives to eliminate maladaptive behavior and emotions. In fact, thoughts, feelings, and behaviors are continuously interrelated in the context of core beliefs, whereby cycles are amplifying and perpetuating effect on symptoms while recognizing existing core beliefs at the same time. The basic cognitive organization structure works in the sense that we have a activating event. So structure is activating event, and based on that activating event, we have a set of core beliefs, thoughts, feelings, physiological response, and behavior. An external event acts as a trigger to activate the underlying schema or core belief. Based on underlying assumptions that the interpretation is real, logical, and meaningful, automatic thoughts are constantly generated much outside our conscious awareness. Yet, they have a powerful impact on our conscious thinking, feeling, and physiological responses that are all designed to test reality and respond appropriately. But in the context of severe or chronic distress, it is common to lose the ability and balance of objective examination when coping defenses kick in to meet emotional needs, according to Beck 211. Again, it is not the intention to provide a detailed account of theory and practice of CBT during this lecture, but rather to highlight principles and differences and key issues that were important in the development of CBT. To summarize, some of the key points of CBT, the cognitive principle involves interpretation events, but not the events themselves, is a crucial distinction in CBT. The behavioral principle emphasizes what we do as a powerful influence on our thoughts and emotion. In the continuum principle, mental health problems are best conceptualized as exaggerated or avoided of normal processes. In CBT, the focus is strongly on the here and now, as it is usually considered to be more fruitful to focus on current processes instead of past experiences. In the interacting system principles, problems are viewed as interactions between thoughts, emotions, physiology, and behavior, and the environment in which the person operates. CBT is based on the empirical principle whereby an evidence base is established for theory and practice. So taking into consideration the stages of CBT treatment, there are many variations in methodology in applications. But according to Turk and Floor 213, the traditional CBT methodology has 6 basic phases, namely 1, assessment, 2, reconceptualization, 3, skills acquisition, 4, skills consolidation and application training, 5, generalization and maintenance, and 6, post-treatment assessment follow-up. So the assessment stage involves interviews with patients and their families that are supplemented by a series of psychological self-report test measures to identify the degree and nature of the psychological impairment, including automatic thoughts, irrational beliefs that underlie it. The most appropriate course of action is determined. 2, reconceptualization involves dispute and challenging of automatic negative thoughts that are irrational beliefs. Clients are asked to provide evidence attesting to the truths or falseness of their beliefs, consider what they are logical or not, and contemplate functionality of new alternate beliefs. CBT holds that irrational beliefs are inconsistent with reality, therefore illogical, and yield negative results. By developing and considering functional alternative beliefs, cognitive restructuring takes place. 3, the in-skills acquisition phase. Behavioral activation is enabled as the client is guided to improve social and cognitive skills in order to execute cognitive restructuring. Skills use is an important mechanism to change that contributes to positive treatment outcomes. Examples of skills: communication, time management, planning, awareness, motivation, and pre-social behavior. In number 4, in the skills standardization and application training step, clients are given homework to help reinforce the skills that they have acquired in the previous stage. Homework is reviewed at each following session and serves to provide feedback on progress on the practical application of different tools, skills, and techniques. Quality and quantity of homework is considered an important predictor in treatment outcome. 5, generalization and maintenance is conducted by discussing the future and ensuring that the clients are well equipped to cope after treatment and completion. 6, in post-treatment assessment follow-up, clients are monitored and evaluated to determine how effectively they continue to apply CBT skills and techniques in everyday lives and day-to-day functioning. In this lecture and discussion of the important principles and practices of CBT, several points worth noting stand out. In general, there are 2 main criticisms. Firstly, CBT provides a model of cognitive restructuring and learning, but takes minimal consideration of early development and the effect that past experiences have on psychological and personality structures. However, a person's temperamental characteristics and beliefs that form the essence of his or her personality have a profound effect on this interaction and attachment with others, especially in the home. First as a child, then later on as a parent. The repetition over time of early patterns of interaction anchors perceptions, thoughts, feelings, beliefs, values, attitudes, behaviors that are commonly, constantly, reciprocally influenced by anticipated actual response from others. Secondly, the fact that beliefs and conditions are treated as irrational can be deeply invalidating and negatively aspect that are essential change agents, including self-concept, therapeutic alliance, cooperation, commitment. These concerns were basic impotence for most of the third-generation therapies that followed, most notably the integration of the concepts of acceptance and mindfulness, which we've discussed in previous lectures. The effectiveness of CBT is well established for adults with a variety of psychological conditions, according to the research. In particular, CBT has been used for depressive disorders, anxiety, post-traumatic stress, and other dysfunctional behaviors such as aggression, substance abuse, addictions, generally stress and eating disorders, and self-injurious behaviors. Literally thousands of trials prove that CBT is currently one of the best established and most widely used therapeutic treatments, although more work is needed to verify results for specific populations. For example, younger people, elderly people, ethnic minorities, and low-income samples. So just to emphasize, CBT, cognitive behavioral therapy, focuses on thoughts and feelings that underlie behavior in the present. CBT is the most widely used and researched psychotherapy method. CBT is structured, systematic, and relatively brief approach to improve psychological functioning. CBT is present oriented, does not focus on past roots or of current problems. CBT identifies disputes and modifies automatic negative thoughts.